Hello and welcome to the program. I'm Beatrice Marshall. Last week, we delved into the push and pull factors driving brain drain in Africa, highlighting why so many skilled professionals leave the continent in search of better opportunities abroad. This week on Talk Africa, we examine how the loss of irreplaceable professionals and expertise hamper growth. To turn the tide, we discuss solutions that can potentially curb brain drain and promote sustainable development in African nations. Welcome to Talk Africa and stay tuned for this in-depth discussion. Well, let's now bring in our panel of experts. With me in studio, Dr. Auma Oluga, health workforce expert. Joining us from Abuja in Nigeria, Basil Abia, co-founder of Verif Africa and a policy analyst. And joining us from London, Edwin Ikuhoria, international development and policy advocacy expert, both joining us via Zoom. We're also joined here in studio by a live audience, students from the University of Nairobi and Daystar University. Thank you for being a part of this discussion, and a very warm welcome to all of you in this discussion. Well, let me start off with you, Edwin, because in our previous program, we heard about the numbers of professionals leaving Africa and why. Now, an estimated 10 to 12 million young Africans join the labor force each year, yet the continent is only able to create about 3 million jobs annually. So under these circumstances, is it really possible to stop the brain drain from Africa?
The short answer is that it's no. When you call it brain drain, but it could be turned on its head and call it brain gain. The most important component here is that people will go where the opportunities are. People will not stay. For you just mentioned it. 12 million jobs are needed. 12 million young people join the job market every year, but only 3 million formal jobs are being created. So what you get then for the remaining 9 million are informal jobs. Jobs that do not really give enough or give the kind of compensation that people are looking for. So what is the natural result of that is that people will migrate. So it is a normal economic process. People will definitely migrate. Africans will migrate, and Africa cannot even afford not to migrate, because at the end of the day, there are other benefits of migration, labor mobility that we can talk about. But to just let you know that the opportunities would always attract African professionals across the world. And we are very good at what we do, especially when we are in a context that allow us to thrive.
But what are those benefits? Give us a little brief of those benefits you mentioned there.
Say medicine. There are some kinds of equipment and systems and processes that do not currently exist in Africa, that when African doctors go out and practice in those climes, they get used to that. That in turn builds their human capacity. And when they come back, if they come back, they're able to transform the African processes and systems as well to increase and improve ways of doing things. There are many diagnostic tools that African doctors are not exposed to. They only hear about them in textbooks. But when they get abroad, then they are able to expose themselves to these systems and processes and diagnostic tools that they can come back with. What about remittances? I'm sure maybe in your previous program, you talked about the volume of money coming back to the continent in terms of remittances. So you would see that the economic benefit of that, more people are able to go back to school at home because of the transfers that came from those who are working abroad. Right. And that in turn will improve the human capital of those that are at home. And when that happens, of course, it helps to generally increase productivity across the economy. So there are tons of them, I can tell you.
Dr. Oluga, the economic benefits of this migration, can it be reversed to be a brain gain, so to speak?
Yeah, I mean, what Ikuhoria is saying is largely true, especially on the issue of technology and the exposure to professionals and the building of professionals. So we just had one of the Kenyan doctors voted to be the president of the American Physician Association. And of course, that level of exposure, including leadership, if it were transferable, unfortunately, there are other factors that make some of these things not transferable. And I think in the immediate, it is not possible to stop brain drain. And I think we're not trying to say that, oh, don't leave. I think the most important thing, and especially for me, is to develop the consciousness that we as a continent and as countries, African countries, we can also put measures that allow our people to develop here because they want to develop here. But now that people are going and people have gone, I think it's also important that we put policies that enable their participation back home beyond the remittances. Yes, the remittances are nice, but I think it's a smaller picture than what we can do. For example, in especially areas of research, we are having a lot of also, and I have to say this, expatriates coming to Africa, and they are gaining. For example, Africa does not own the malaria vaccine patent, you know, and these are some of the things I talk about. But all the research that led, 40 years of research that led to development of that vaccine, where was it done? In Africa. So where were the experts? You know, so there is another expert that has come from the UK, from the US, to do research here with malaria. 40 years of knowledge. We don't own any single patents. We don't own that data. So where is the expert that went to the UK 40 years ago? And that's why I'm saying that what we are losing is much bigger, because if you're going to develop the vaccine, if you're going to develop all these technologies, you can imagine the volume of sale of malaria medicines worldwide.
So let me ask that question back to Edwin in terms of this brain gain, because Dr. Oluga is asking, where is that expertise that left the continent for, you know, European shores some 40 years ago?
No, that's the issue. In fact, if there is any topic we should be discussing today, it's really about what are the policies we should put in place to allow African professionals who have gained knowledge, expertise abroad to be able to invest back home, not just in terms of their money, but also in terms of their expertise, especially given technology. I'm speaking to you from London, right? And it's like I'm live in your studio. There are several ways. It is now a lot easier to rely or to take on the expertise of Africans in the diaspora. But the question is, are we even conscious? And I think the doctor mentioned a good word. Is Africa even conscious of the potential and harnessing it and designing policies to harness that? That is where the gap is. As far as I'm concerned, the level of knowledge, the expertise, the level of development, the malaria vaccine that you talked about, how many African countries that has not been able to spend even 5% of their annual budget on health will invest in long-term study, over 40 years of study to develop a vaccine? How many? That is the question. But on richer countries that can afford to do that, they are developing the vaccines. Of course, they will have the patience because they've made the investment. That is correct. Now, so we need to think about it strategically and do the right policy, the right investment. And there are some programs actually that are already thinking about it. The World Bank is already working with some African countries to think about how to harness the power of proper migration for migrant labor workers so that they can also harness and use their expertise back home, and then ensure that it turns out to be a brain gain rather than a brain drain that we've been talking about. I just want to leave it there.
Right. Basil, to you though, is Africa conscious of the potential of its professionals? Because trends show that the flow is really from Africa to the developed world. What does this tell us about Africa? Are the outflows huge enough to have that impact on the skills gap?
Yeah, there's a consciousness of that potential. There's a consciousness of the vastness and the scale of the brain drain, the skill death that the continent is currently enduring through. I must add that the African Union already has a migratory policy framework that they've already set aside with recommendations for how to be able to avert this brain drain, and also policy recommendations to take advantage of the brain drain as well. But again, coming from the Nigerian perspective, there's been legislation or legislative activity around averting that further brain drain, especially in the medical sector. For instance, for the last 2 years, there have been moves to set aside the legislation that makes it or prohibits medical workers from leaving immediately after they've gotten their education for 5 years. So your first 5 years after you've gotten your education from any Nigerian institution, medical institution, you have to be able to work in Nigeria. The amount of money that Nigeria is spending on training medical workers, if you juxtapose it with the labor cost and the technical cost, that's the amount that we've lost in the last 5 years, $2.6 billion US. So Nigeria is very much aware of that potential that we're losing every year. It can also be highlighted from monetary terms, and I think the numbers are already provided. But moving forward, like I said, there's legislative activity to apprehend.
I want to jump in there, Basil, because I want to bring this particular issue to Dr. Oluga, the whole question of remuneration versus the actual workload. Are African countries or are African governments really concerned about this mismatch? Because if you look at where African, the highest paying versus the actual work that it entails in the various sectors across the continent, are African governments really concerned about this?
They say they are concerned about it. So if you read the policy document, they keep saying they are concerned about it. There are many African governments that now have what they're calling health workforce policy. The WHO and the Africa CDC, they just launched last month in Namibia, Windhoek, what they're calling the investment charter for health workforce. So on paper, they have signed that they want to invest. But in practice, we have signed a bilateral labor agreement with the UK to export the nurses. That charter says don't export. Ghana has also passed a migration policy, Nigeria the same. UK alone has 9,000 Nigerian doctors. So, you know, so on paper there are very beautiful policies that are not implemented. So the biggest challenge with the African governments is that they have developed this nice, so they agree to good things. In fact, it's very challenging for people who are in advocacy like yourselves and ourselves. If today I went to the Kenyan government and told them something, they'll agree with me. They'll even put it in a policy. The gap is in the implementation. They don't do what they mean.
Edwin, let me get this from you. The mismatch in implementation by African governments, where is that mismatch? Why is there a mismatch?
I mean, I'm just going to be very blunt here. There is a lot of challenge with the political economy of policy making, right? So politicians are voted in within 4 years. They should make their mark and they are out. What does that lead to? It leads to, political priorities to serve the masses where they think what will make them popular, rather than they take the hard route. The hard route here means, looking at the statistics. But beyond that, I want to say that it is about the Philippines, India. India has harnessed the opportunity with migration. So we've seen how India is transforming the tech sector globally by being conscious, by consciously harnessing the opportunity. IIT in India is one of the toughest schools on earth, but it is 1/100th of the cost of going to Harvard, right? But IIT graduates go on to Stanford to become the best, and they rule the tech world today. So when we talk about the cost of training in Africa, it's low compared to the cost of training outside. It could be our own comparative advantage. I know many of my colleagues have argued with me to say this is like going back to neocolonialism and slavery. But I disagree with that completely, in the sense that we could take over the sectors that we are good in. Medicine as an important part that we're talking about here. The UK, the NHS is overwhelmed because of the elderly population.
Right.
But African countries should have seen that as an opportunity to train doctors. And then the rest of the world will depend on Africa to provide the doctors.
Right.
That is a way to go, but it requires serious thinking, not popular thinking.
I want to hear your thoughts, Basil, because you talked about Nigeria's position and Nigeria's policy-making steps. Rwanda tops the World Economic Forum's list as one of the countries that has managed to retain its professionals. What are some of these countries, such as Nigeria and Rwanda, what are they doing?
The major reasons for the brain drain in Nigeria are due to the poor worker conditions and the very poor remuneration. So if Rwanda is topping the list, it's obvious that they're doing the opposite. The remuneration packages are very well top of the market needs. And then outside of it, of course, the worker conditions are slightly better. And to add to Edwin's part as well, there's hope because institutions are working, and there's this, you're sure that in the next 5 years, there's incremental growth in certain sectors. And that obviously gives a number of these workers the rationale to be able to stay back and say, you know what, I want to contribute to this very good situation happening back home. If you have a situation where state governments are owing workers 12 months, 15 months, 16 months, there's just no incentive or rationale to stay back. Of course, you're going to want better working conditions. And if Australia or even Malta or Cyprus is offering way better than that, you're better to take that, because again, as human beings, we're logical and rational beings, and we look out for better conditions rather than stay back.
So, Dr. Oluga, what would it take to retain African professionals on the continent?
Three things that would retain African professionals in the continent. And one is their participation in the development of Africa. People believe that you need a lot of salaries and money. No. I have colleagues who are in America and the UK. They earn way more than me, but I don't mind that, because you know, if I can participate in the change, if our governments in their governance, and then this is something I wrote about in terms of leading the health workforce, you have to enable them to make decisions that they feel are fulfilling to them and are making an impact. That's number one, participation in the whole development of Africa. Number two is that we have to have inspirational leadership that gives a vision that we as a people are going somewhere. Number three, which is very, very important, is that investment and development must be wholesome.
Right.
So we can retain African professionals.
Right.
Let us utilize them to develop the continent.
Right.
And this has happened. And I believe that this is what Rwanda is doing. I don't think that Rwanda is matching those salaries that their professionals from Harvard can earn. I don't think so. I don't even think they're giving them 10% of that. But they're giving them a platform to be part of the change in their country. And I think that's the most important thing.
So, Edward, let's continue with that conversation about retention, because we have seen as an example, though, that there are more Ghanaian nurses working in the UK than in Ghana. Are there safeguards, for instance, to stop rich countries poaching from poorer countries?
There are several frameworks that have been developed. The WHO has even listed some countries that have the most dire situation. But I want to say that you could do this, but I tell you, I'm being practical here, pragmatic here. People will still find their way to go where their opportunities are. That is the reality. Even the same laws that have been put in place. I know the UK, for instance, at some point they have what they call the red countries, where they will not recruit from. In fact, they stopped recruiting agencies from taking professionals from those health workers from those countries because of the dire need at home. But let me tell you something. In the same countries that they are, check the level of unemployment. So it's not like people are there and they have jobs to do. That's the contradiction here, and that's what I really think that we should think about. And this is why I'm saying that when you have the frameworks in place and there are policies to reduce or stop recruiting professionals from certain countries because of the dire need in those countries, the question is that you should be hoping that there's already full employment in those countries. The only factor is bad working conditions. That can be addressed. But in Nigeria, I'll give you an example. 75,000 qualified doctors, only half of them are retained. Are all of them working? The answer is no. There are some workers doctors who have graduated, who have still not been able to find a place for residency almost 6 months after they qualified. That is the reality. And then you come and talk about not recruiting from there. Of course they will go. So what I'm saying in essence is that we could think about retention when we provide full opportunities at home. But with where we are right now, for many years of mismanagement and bad economic policies, we have created a place where we graduate professionals and there is no opportunity for them to be gainfully employed. So there's no way they would waiting because of one government is not. If they don't get it the legal way, they will go the illegal route. And that is what we don't want. Can we be strategic in designing to make sure that our excess professionals can be exported and we get the full benefit of that, covered with good labor coverage?
Right. I want to get a very brief comment from all of you. And let me start off with you, Basil. If there is one thing you would want African countries to do to reverse the brain drain tide, what would that be?
For me, it would be first and foremost to improve the working conditions. The working conditions are appalling. This is the case in most African countries. The exceptions are very few, not more than 10 countries. And we need to be able to ramp up efforts. If there is the galvanizing force behind the AU, as well as the member states themselves, with an sort of like an accountability structure. Surely, please, let's get that done, because there's no way 140 hours per week for a surgical doctor in Nigeria, or about 120 hours for a resident doctor in Ghana is tenable. That's just unacceptable. Obviously, remuneration packages, health insurance, and other compensation packages will help out. But let the worker conditions improve. Let the state of the infrastructure of the hospitals, state of the infrastructure of the research institutions that our researchers are working in, let the state of infrastructure for the other educational institutions that our skilled professionals are working in, let them improve radically. So we need to have a robust investment in infrastructure to ensure that the worker conditions are better, but also our working codes should be drastically improved so that the working conditions are far better. And I think those are some of the reasons why our professionals would want to stay back.
Dr. Oluga.
The one thing that I think we have to do is to improve our governance, and especially economic governance. And that economic governance is to guarantee only one thing, that my effort is directly proportional to the reward. That's all. That's all. That's everything that makes enterprise thrive, professionals thrive, research thrives. That if I put 20 hours of being the best I can be of a doctor, that there will be a reward. And you don't have to even employ me, that there will be a reward across the board. Economic governance.
Right, so I'm going to take a few questions from the audience. Yes, let's start off with you.
Good afternoon, panelists. My name is Marcus Mburu from Desa University, and I wanted to ask, in regards to the economy, would you say that the future is brighter for those who are unable to leave the country?
Right, second question.
Good afternoon. I'm Vanessa Kirupo from the University of Nairobi, and my question is, how does brain drain advance neocolonialism?
Yes, another question.
My name is Tony Ogutu, a political science student from the University of Nairobi. When I look at brain drain, I look at it from two perspectives. One, where skilled workers have to physically travel out of Africa to go and look for greener pastures abroad. And number two, with advanced technology, we have a scenario where remote works are made possible. So my question is, how can countries, both the sending and the receiving countries, harness the online platform to solve this problem of brain drain that we have?
All right, members of the panel, who wants to go first?
This is the given fact. You will work for somebody, whether you work at home or you work in the US or you work in the UK, you must work for somebody. And so, as it happens that in our system, with the current situation we're in, many African workers are working for former colonial, powers, because, in the global north. But when we talk about the economic impact of that, the question is that in colonial times, you are not getting fair wage. You're not getting paid for the work you are doing. You're paid, or you are underpaid for the level of work you are doing. But in today's time, the question is that, are professionals leaving the continent getting fair compensation when they go work? Are you earning at the same level with your peers who are working in the same climate with you? That is the question we want to ask. And if that is the case, I think we can reverse the story of neocolonialism, because whether the business entrepreneur is in Africa, or is in Nairobi, or is in Lagos, or is in Cape Town, whether it's the owner of the company is white or black, it doesn't really matter. You will work and you will get paid. So is the compensation fair? For cases where we have seen this this informal work, particularly household work and all of that, that is a classical case of neocolonialism, because we are doing menial jobs. But when professionals like doctors are going to work in hospitals that are established in the global north and are getting fair compensation, that is where I do not see that as neocolonialism. And if that is happening, this is where our countries are supposed to stand behind us and have those kind of agreement to examine how are we being compensated. Do we have rights as migrant workers? Are we being compensated fairly? Are we able to have our unions? Are we able to get representation? Those are the kind of things we need to be asking for. But where they don't exist, like in domestic work, that is a clear case where we look like we're going back to neocolonialism. So we need to think about strategically, how do countries work together to reduce the cost of remittance and to get fair wage and fair labor? And in that case, you cannot call it neocolonialism, you call it a win-win partnership. I want to leave it at that question.
Yes, Dr. Oluga, by 2050, Africa's population will be 2.5 billion. So the second question there, what is the future outlook for those who will not have emigrated?
Yeah, that question I can answer it in two ways. So one is the future in Africa? The future is certainly in Africa. So you went to the UK, you're working there, you're earning. Your colleagues in the UK, what are they doing? They're coming to set enterprises in Ghana. But they're white, they're not Ghanaians. Because of that population she's talked about, the future is certainly Africa. All over the world, Africa is the emerging market, unexplored, educated population, youthful. 65% of Africa is below 30 years. How then do we create this opportunity? This is where our governments come in terms of the economy, but also as an individual, I think what I would advise, especially if I were to give career advice, is get the skill and try to get the support. But certainly do something in Africa. The dividend will be huge, whether you want to do it with partnership or whether you want to do it individually.
So Basil, the question of technology, how can countries harness the online platform?
Very easy to do that. I think first and foremost is to enable communities for innovation. And one of the things that in Nigeria I would really give a thumbs up for is legislation that enables for these communities to continue to enable further innovation. On the African continent, there are very few countries that have more than 100 technological and innovation hubs. Kenya is one of them, Nigeria is one, South Africa is one, and Egypt is one. So for the continent, we'll need to scale up those numbers. And one way to be able to do that, like I said, is the enabling policies that attracts as much private capital as possible, so that there's infrastructure investments in those innovation hubs. Outside of just enterprise for profit, there's also social development efforts that can be built around that. But again, government has to govern. And part of that governing is ensuring that there's enabling legislation, there's enabling policy frameworks. And trust me, the people will take full advantage of it. Africans aren't lazy. Africans are very innovative, they're daring. Just give them the enabling environment and they'll do it. And we see that in Kenya, we see that in Ghana, we see that in Nigeria. We just need more of that. We also need a lot more of that equitable distribution, so that smaller landlocked countries, for instance, like Chad, Central African Republic, Malawi, also take full advantage. Once we're able to do that, trust me, we'll be able to take advantage of remote work. We'll be able to put and ensure that our skills are retrenched, and brain drain is, especially in the technological space and innovative space, brain drain is curtailed.
All right, gentlemen, very interesting discussion indeed. Thank you all very much for being a part of this discussion. But that's all we have time for on this edition of Talk Africa. A big thank you to our panel of experts, Dr. Auma Oluga, health workforce expert, joining us here in studio. Basil Abia, co-founder of Verif Africa and a policy analyst, joining us from Nigeria. Edwin Ikuhoria, international development and policy advocacy expert, joining us from London. I would like to also thank our live audience, students from the University of Nairobi and Daystar University. Remember, you can be a part of this conversation through our social media platforms on Facebook and X, and you can also watch this and other editions of Talk Africa on our YouTube playlist. Do join us again next week for more Talk Africa. From me, Beatrice Marshall, and the team here in Nairobi. Until next time, bye-bye.